So, chapter 6 really focused on road dispute and interpersonal therapy, which is known as IPT. And IPT, road disputes, are one of the main problem areas that contribute to depression. So, a road dispute can occur when two people in a relationship have different expectations about how the relationship should function. So, these conflicts often happen in close relationships, such as like spouses, family members, or even coworkers, partners. When these disagreements continue over time, they can create stress and even emotional distress that can contribute to these depressive symptoms. So, this chapter really explains that role disputes often develop because communication tends to break down, or because each person has different needs and they're not clearly being expressed. So, one person may feel unsupported, criticized, or even misunderstood, while another person may not fully understand the impact of their behavior. And over time, these ongoing conflicts can lead to frustration, resentment, and emotional distance. So, in interpersonal therapy, the therapist works with the client to explore how these relationship conflicts are affecting their mood and just overall well being. The text also explains that role disputes usually occur in three different stages. So, the first stage is recognition. So that's where both people recognize that there is a problem, and are still attempting to resolve it. The second stage is impasse stage. So that's where communication becomes more difficult, and both individuals may kind of feel stuck in the situation, or they believe that the other person won't change, or that all of their efforts are for nothing. And then the final stage is this solution. So this is where relationships begin to break down and that emotional distance becomes permanent, right? And it becomes bigger. So understanding which stage the client is experiencing helps the therapist decide how that treatment is going to work and how we're going to basically guide the intervention. So, in therapy, it's important to remember that the goal is not to determine who is right and who is wrong in the conflict. Instead, the therapist focuses on helping the client better understand the disagreements so that way they can improve communication. So, clients may learn how to express their needs more clearly, listen to the perspective of others, and even develop healthier ways to respond during that conflict. So, the therapist may also help the client consider possible solutions or ways to renegotiate expectations within that relationship. So, several techniques are commonly used to address road disputes in IPT. One example is communication analysis. This is where the therapist and client look closely at specific conversations to understand where these misunderstandings are happening. So, role playing may also be used to help the client practice expressing feelings or setting boundaries in a supportive environment. So, really just going over the situation, being like, what can we have improved on? Let's try this and this to see if like the outcome would have been different. So, these strategies allow the client to develop new communication skills that then improves the relationships and reduces the emotional distress that is being brought on. So, when role disputes remain unresolved, they can increase stress and they can contribute to depression. So, by helping clients improve their communication styles and address relationship expectations, interpersonal therapy can really reduce the different symptoms and strengthen interpersonal functioning. And not even that, it just overall improves communication. So, whatever relationship is being affected can improve, but it also helps in any other relationship that they have with anyone else because they can apply it to not only that one situation, but everyone.